1 in 4 girls and 1 in 13 boys will be sexually abused before their 18th birthday. The Children's Advocacy Center of Kent County exists to support young people and their families through law enforcement, counseling, education, and empowerment, among other things. Leah Ortiz is the president and the CEO of the CAC, here to share more about their mission. Leah, thanks so much for being here.
Thank you for having me.
All right, so this is a hard topic, obviously, to talk about, but it is a very necessary one. Yes. Talk about the CAC, your mission, and why the community needs your support.
Absolutely. Thank you. The CAC exists because we have a community-wide problem that really necessitates a community-wide response. And so under one roof, the center has the complete multidisciplinary team to treat and prevent child sexual abuse. So we have law enforcement, the prosecutor's office, the YWCA we partner with. We have in-house forensic interviewers, therapists, advocates, CPS, all centered around protecting children.
Yeah, and having it all under one roof not only makes it convenient for the process, but that's crucial when you're dealing with small victims who are experiencing something that's going to change their lives.
Absolutely. We know that only 86%, well, I say only, 86% of abuse does not go disclosed. And so that fraction of abuse that is disclosed, when they are telling their story, to have to tell it over and over again, between talking to law enforcement, talking to CPS, telling your therapist, going to the court, it is traumatic in itself. And so by having everything under one roof, they have to tell their story one time, which reduces the amount of trauma that they experience in living through that trauma they experienced of the sexual abuse over and over again.
Yeah. And there are lots of ways the community can get involved. And those numbers are just staggering to me, that 86% are not reported.
Yes.
So we've got the 1 in 4 girls, the 1 in 13 boys. But that, those numbers aren't necessarily accurate.
And to tell you the truth, Michelle, those are statistics in the CDC, the Center for Disease Control, says 1 in 4 girls and 1 in 20 boys. The Department of Justice says 1 in 6 boys. And so the reality is, when abuse is not disclosed, we cannot have accurate numbers. The average age of disclosure is 52. Yeah. People will go most of their lives before disclosing abuse. And when they go that long, the amount of impact that has on their personal lives and as well as their physical health. We have cancer, we have heart disease, substance use, suicide, number of issues that people struggle with throughout their whole life without receiving the treatment that they deserve, that they really, to be honest, going back prevention-wise, should not have had to endure if we would have had enough preventative efforts in place.
Absolutely. And talking about Child Abuse Prevention Month, it's a great time to bring this up. Make sure that people are aware of the services that are available. This is all completely free as well.
Absolutely. No cost to any of our services. We certainly don't want victims to feel re-victimized by having to pay for the trauma that they experienced. And so all of our services are at no cost at the center. April is Child Abuse Prevention Month, and so we're really calling on the community to support us in bringing awareness to the work that we're doing. We do a lot of prevention in K through 4, kindergarten through 4th grade in Kent County through our Kids Have Rights program, which was developed right there at the center. And we modify it each year to change with the ever-growing needs of kindergarten through 4th graders. And we're really excited about that program. We know that we've reached just under 26,000 students just last year. Wow. We have so many more thousands to reach, but prevention is just the first step. And so that's what Child Abuse Prevention Month really does. It brings awareness to the prevention needs so that we do not have the 1 in 4 or 1 in 6, 1 in 20 children that are impacted by sexual abuse.
Oh yeah, you hope that getting that education piece out there is going to hopefully impact them down the road, right?
Absolutely, absolutely. Yeah. And the sooner they receive treatment, we know the sooner their symptoms of depression, anxiety, post-traumatic stress also decrease. And that is all right there at the center in one place where they can also receive those services. So we're really asking for the community to reach out to the center to learn more, but to support our efforts, we're asking everyone to wear blue in April. That is the color for awareness. And we'd love for corporate and business partners to join us by sponsoring a day for their team, $500 to sponsor that comes to the center to provide those services at no cost to the family, simply by wearing blue or choosing to wear blue jeans, which everyone loves to
go.
wear blue jeans,
Yeah, right?
Especially in the day-to-day when you maybe don't get to wear jeans to work on a typical day.
Right? Oh my gosh, I love that. Just so easy. And you have a luncheon coming up as well. So
do.
it's a great opportunity for people to learn more about your mission and to
Yes.
support the cause.
Yes, and anyone can find the information on our website for our luncheon. It is May 7th. It is our one time a year, our annual event that we have every year to talk about the impact that we've made over the past year, but not just from the center, but because of the partners that we've worked with throughout the entire community. So it's a really great way to showcase the work that we're doing, but also celebrate the success and prevention that we've had through the month of April for our Child Abuse Prevention Month.
Wonderful. Yeah, thank you so much for all you do and for being here and sharing this with us. So April, of course, Child Abuse Prevention Month. Lots of ways you can get involved. May 7th is Believe the Child Luncheon. You want to learn more about the different ways you can learn and support the Children's Advocacy Center, cac-kent.org for more information.